Hey everyone, this is a little bit different from what I've been posting recently, but I just thought it was too cool not to share. So I recently made a GPT assistant to coach doctors on how to speak more empathetically to patients. It's using this new feature on ChatGPT called GPT Assistance. And I just want to show you how this works and get some ideas going. So what you see is my screen on ChatGPT with EmpathMD, a GPT assistant. So I'm just going to start talking to it. Hey, can we start a new simulation?
Absolutely. Please describe the scenario you'd like to simulate, and I'll take on the role of the patient. What situation should we start with?
Can we start with a patient receiving a diagnosis of cancer?
Of course. Let's start the simulation now. I'll be a patient who has just been told they have cancer. I'm sorry to say, but the test results confirm that you have cancer. Looking shocked and visibly upset. Oh no, this can't be happening. Are you sure? How bad is it? The conversation continues from here. Please proceed with your response.
It's pretty bad. We caught it at a very late stage.
Tears well up in their eyes. Late stage. So what does that mean for me? Is there any treatment that can help? I'm feeling really overwhelmed right now. They seem to be struggling to process the information and are seeking reassurance and clarity about their options.
Well, we'll have to see. The options for treatments are pretty limited because it's so late stage and you came to us very late.
Becoming increasingly anxious. I didn't realize the symptoms were that serious. What are my chances with the treatments available and what should I expect in the coming months? The patient is looking for specifics about their prognosis and what their treatment journey might entail, indicating a need for clear and compassionate communication.
Well, we will have to start you on chemotherapy. It is a long treatment and it will be rough. You will probably need the support of your family, and but this is the only option we have since you came in very late.
Nods slowly, trying to hold back tears. Chemotherapy, I've heard it's tough. I'm scared, but I understand it's necessary. How do I even begin to tell my family about this? And are there things I should do to prepare myself for chemotherapy? The patient is clearly worried and is looking for guidance on how to navigate this challenging journey, both emotionally and practically.
End simulation, please.
Simulation ended. Thank you for participating in this scenario. Feedback. In this simulation, you handled the difficult task of delivering a late stage cancer diagnosis. You maintained a straightforward approach when discussing the severity and the treatment plan. In future scenarios, consider also incorporating elements of empathy and support, acknowledging the patient's emotional state and offering resources or referrals for psychological support. Patients in such situations might benefit from reassurances that their medical team will be with them every step of the way. If you have any questions about this feedback or wish to start another simulation, feel free to let me know.
Can we start a new simulation, please?
Absolutely. Please describe the new scenario for our next simulation. What patient situation would you like to explore this time?
Can you just come up with a simulation, please?
Sure, let's set up a new scenario. Simulation scenario. You're a doctor speaking to a patient who has just been diagnosed with type 2 diabetes. The patient, a middle aged individual, is surprised by the diagnosis and is worried about what it means for their lifestyle and health. Doctor, I've reviewed your test results and they indicate that you have type 2 diabetes. We need to discuss your treatment options and lifestyle changes. Diabetes? but I feel fine. Does this mean I have to change my whole life now? The conversation continues from here. Please proceed with your response.
I understand this is a shock. It may be very distressing, but don't worry. Diabetes is a condition that we can take care of together. You might have to make some changes in your lifestyle and with some medications, but I'm here for you. Firstly, just tell me, how much do you know about diabetes?
Appears slightly relieved but still concerned. Thank you, doctor. That's comforting to hear. I don't know much about diabetes, honestly. I always thought it was something that happened to other people. What kind of changes are we talking about? And what exactly does having diabetes mean for me? The patient is seeking information and reassurance, indicating a need for education about diabetes and its management.
So, the kind of diabetes you have means that your body is not able to handle the sugar that you put into your body. So, we need to come up with ways to help your body handle that sugar and at the same time also reduce the sources of sugar that you put into your body. So, what we'll need to do first is start some medication that will help control the sugar in your blood. And then I'm going to recommend some changes in your diet and activity that'll help keep this down. Um, Improvements in diabetes are totally possible. In fact, in some cases, it is also possible to reverse it, but that's a later thing. Let's first start with some small steps and then see from there.
Nods, showing a mix of concern and motivation. I see. Medication and lifestyle changes. Got it. It's a bit overwhelming, but if there's a chance to improve or even reverse it, I'm willing to try. Can you help me understand what kind of dietary changes I should make? And what about exercise? I'm not really active, to be honest. The patient is eager to learn more and seems ready to take the first steps towards managing their condition, indicating an openness to guidance and advice.
Okay, let's take this one step at a time. So, the most common sources of sugar in diet are things like carbohydrates, breads, wheat, flour. But before I give you sort of personalized advice, why don't we do this? Why don't you keep a food journal for the next week and share that with me? And I can take a look at that and help you figure out what are the foods in your diet that we could cut down on, and how could we also change the pattern of eating that you are doing. And on the activity side, we don't have to start so quickly. What we can do is just start with a 15-minute walk every day, maybe 15 minutes in the morning and 15 minutes in the evening, just to start to get some activity in. This helps in controlling your body's response to sugar. So, how does that sound to you?
Patient. Okay, that sounds doable. Keeping a food journal and starting with short walks seems like a manageable start. I'll definitely do that. It's good to know we're taking this step by step. Thank you for breaking it down for me. I was really worried, but this feels like something I can handle. The patient appears more at ease with a clear, manageable plan and appreciates the step by step approach, indicating a positive response to the guidance provided.
Okay, how about I see you in a week and we'll discuss all of this again, and we'll also see your response to medication. Is there anything else that you have questions about right now?
That sounds good. I'll see you in a week with my food journal. As for questions, I guess I'm just wondering about the medication. Are there any side effects I should be aware of? And should I tell my family about my diagnosis? I'm not sure how they'll take it. The patient is curious about the practical aspects of their treatment and is also considering the social and emotional implications of their diagnosis.
Telling your family is a personal choice, but I would recommend finding support in your friends and family because they can support you in your diet, activity. These are things that'll help. And diabetes is a totally normal and common diagnosis. We can do this together. In terms of the medications, that's a great question, actually. So we're going to start you on a dose of medication, which I think is safe. One thing to watch out with diabetes medications is if the dose becomes too high or is taken in a not so good way, then you can have cases of very low sugar, and that would feel like fatigue and tiredness. We don't want that to happen. So I'm going to be monitoring you for that. The risk for that is very low in the medication I'm going to give you, but that's something that you should be aware of.
Okay, I'll think about how to talk to my family. It's good to know I should have their support. And thanks for explaining about the medication. I'll be careful and watch out for any signs of low sugar. I feel a lot more informed now. Thanks for taking the time to explain everything to me. I'll see you in a week, doctor. The patient seems reassured and more confident about managing their condition, appreciating the detailed explanation and the support offered.
Glad. Can we end the simulation, please?
Simulation ended. Thank you for participating in this scenario. Feedback. In this simulation, you effectively communicated the implications of a type 2 diabetes diagnosis and the importance of lifestyle changes and medication. Your approach was empathetic and educational, providing clear steps for the patient to follow. You also skillfully addressed the patient's concerns and questions, fostering an environment of support and understanding. Remember, acknowledging a patient's emotions and offering reassurance can be as vital as providing medical advice. If you have any questions about this feedback or wish to start another simulation, feel free to let me know.
Is there anything I could have improved in my empathy or my conversation with the patient?
Your approach was quite empathetic and effective. However, here are a few areas for potential improvement. 1. Acknowledge emotions. When patients first hear their diagnosis, they often experience a range of emotions. Acknowledging their feelings, I understand this news can be overwhelming, can provide comfort. 2. Simplify medical language. While you did a great job explaining things, always remember to use language that's easy for patients to understand, avoiding medical jargon as much as possible. 3. Encourage questions. Continually invite the patient to ask questions. This can help alleviate their concerns and make them feel more involved in their treatment plan. And 4. Provide positive reinforcement. Affirm the patient's willingness to follow the plan. It's great to hear you're open to making these changes to boost their confidence and commitment. Remember, empathy in medical conversations isn't just about understanding the patient's feelings, but also about conveying that understanding back to them, making them feel heard and supported.
Awesome. Thank you so much for helping me practice this.
You're very welcome. I'm glad I could assist you with your practice. If you ever need to run through more simulations or have any questions, feel free to reach out. Keep up the great work in honing your communication skills.
Okay, so that was a simulation. Honestly, none of that was really planned. And I hope you get a sense of what is becoming possible with these fantastic foundational large language models, which can now hear, see, and speak. There's a lot of room for improvement here in making this even more helpful. For example, I'm thinking about adding a knowledge base of particularly challenging simulation cases, maybe adding some knowledge base or references for, even more tactical feedback on how to speak empathetically to patients. But you can start using this almost immediately, and you can be doing this on a walk or just on your phone. And I just think that that's quite fascinating and fantastic. If you have feedback, if you'd like to try it, the link will be in the description of the video as well as the post. And I would love to hear how can we make this better. I'm also thinking of ways to open source this so that others can build even better versions of this. Thanks so much, and I hope you found this helpful.